This is a super important question, which is, can I switch from a Medicare Advantage plan to a supplemental or Medigap policy during the annual enrollment period, which is October 15th to December the 7th, without answering health questions? And generally speaking, if you've been in a Medicare Advantage policy, made a couple of changes over the course of the last few years, now you're 72 or whatever, and you're getting tired of this Medicare Advantage thing, the answer is pretty much a resounding no. You're going to have to go through underwriting. One of the carriers, and I won't name which one, used to have what's called underwriting holiday, and they would be inviting everybody to come and participate in their Medicare supplemental policies, and without underwriting, which I just loved. I would have lists of people to enroll in their policy because they really needed to get in without underwriting. And I haven't seen that since COVID, unfortunately. So I pray that comes back so that, people in my book of business or in my communities and states that I serve, I would like to be able to offer that to them. But generally speaking, the answer is no. There are some circumstances where if people haven't been in a Medicare supplemental policy and they've only been in a Medicare Advantage policy for 1 year or maybe 18 months, yes, you can switch. But if you're anything better than 70 years old and you want to make a switch, generally speaking, the answer is no. Check by state and by carrier, because each one is going to be a little bit different. So what may be true in California may not be true in Massachusetts. That's the answer. Generally speaking, no. Underwriting is something that we have to do. These are private policies. Medigap policies are private policies. They're like life insurance policies. They're provided to you on the basis of, where you live, whether you use tobacco. That's a big knockout. Medications that you've been taking that you may not even known that you were taking, like something for acid reflux could kick you out because it was a off-label use of a chemotherapy drug. So you never know what's going to show up. So here's the answer. If you think you're going to want a Medigap policy, get one when you turn 65 or 66 while they're still cheap. Go and get all of your stuff done so you know exactly what you're dealing with. And then when it becomes too expensive, then move out of it.